my name is Michael Efron. I'm the founder of M-Spa, Boca Raton's newest and most luxurious medical spa, and Cutting Road Capital, a private wealth advisory firm headquartered in Boca Raton and parent company of M-Spa. Thank you for the opportunity to share with you today some super exciting ways to grow your practice strategically by partnering with non-competing business professionals. So here's a brief outline for the agenda today. Number one, just a little bit about myself, my story, where I've come from. Number two, what is M-Spa? And how have we strategically partnered with non-competing business professionals? What is our vision for the next 5 years? And then finally, something that I think everyone who's watching today should pay close attention to, a certain call to action, if you will. Before I get too far into my presentation, I am from Boston, born and raised, and like all good Bostonians, I parked my car in Harvard Yard, but I did go to college and I learned to speak properly, so you may or may not hear that accent come through in my presentation. For nearly 2.5 decades, I worked on Wall Street for 3 of the largest investment management shops, Morgan Stanley, Deutsche Bank, and Invesco. I held the title of Senior Vice President of Investment Management and Wealth Advisory Services, and I spent a lot of time working alongside some of the most talented investment professionals in the world. Along the way, I earned 7 securities licenses, and I continued my education throughout my entire career. In 2019, at the age of 47, I decided to retire from the financial services industry to pursue my dreams of creating my own firm, Cutting Road Capital. Dr. Naklis has been my ENT for more than 20 years, probably since the late 90s, and my wife's ENT as well. And we all know how amazing Dr. Naklis is as a doctor and as a surgeon. But unless you're a patient of his, maybe what you might not know or might not be aware of is, in addition to all those things that he does well, you always feel like he's listening to what you're saying. And you always feel like when you're visiting with him that he knows exactly what you're saying. He's able to relate to you and he's able to listen. Believe it or not, that is a rare quality these days. So we've been very happy patients with Dr. Naklis, and when Dr. Hancock joined the practice, she was equally passionate and has an amazing energy about her. And so when I was doing my research originally for M-Spa and really just opening up a medical spa in general, you know, it's easy to read research reports that tell you that there's 5,000 medical spas in 2018 and that there's projected to be 10,000 medical spas in 2023. It's easy to see a report that says the average medical spa is making $1.5 million in revenue in 2018, and that's expected to jump to $2 million in revenue in 2023. And it's easy to look at all the data that you find and see that most of these medical spas that are out there are single owner locations, and that it's a very fragmented market. Like all of the data, it's easy to read it, to research it if you spend the time doing it. But for me, what I was looking for was a medical professional that had the passion, that had the energy, that had a vision, you know, that I shared. And when I started talking about this with Dr. Hancock, it became clear very early on that she had all of the things that I was looking for in a strategic partner, in a non-competing business professional. M-Spa is Boca Raton's newest and most luxurious medical spa. It's about 3,000 square feet, located 1 mile west of the Boca Raton Mall. And it's a facility that we spent a lot of time thinking about, a lot of time preparing for, and a lot of time building. This was a complete ground up project. We've hired one of the best general contractors in the entire South Florida market, and we feel like we're working with the top architects and designers in the area. In addition to that, we've partnered with what we believe is one of the top healthcare law firms in all of the country. And we have, in our opinion, one of the very best website designers and search engine optimization firms anywhere in the country. In addition to that, MSPA is really the collaboration of two non-competing business professionals. Myself, with, as you just heard, a background in the financial services industry, and Dr. Melissa Hancock, board-certified facial plastic surgeon. We share a vision of bringing what could be, we believe, what could be the single best medical aesthetics center in all of South Florida. Our mission at MSPA is to provide a medical, mindful, and modern experience for each client with every interaction. So at MSPA, we believe that we are different from every other medical spa, not only in South Florida, but around the country and around the world, because we have pioneered a medical, mindful, and modern approach to aesthetics. We believe our medical approach, which includes a very highly credentialed staff, but perhaps most importantly, we're led by a board-certified and fellowship-trained facial plastic surgeon, Dr. Melissa Hancock. So for MSPA, we had a very significant vision. If we were going to build Boca Raton's newest and most luxurious medical spa, it was also going to have the highest standards, the highest procedures, policies, compliance, and most importantly, it was going to have to provide the highest level of care for all of our patients at every interaction. We have a mindful approach to aesthetics as well, because at MSPA, we believe it's not just enough to look good on the outside, you have to feel good on the inside in order to be your very best. And what we like to do with every patient at every interaction is listen to how they're feeling in the moment. We want to know how each and every one of our clients is doing at that particular moment in time, without judgment. If you're going to spend time and energy on results and procedures and products for the outside, in order to make that success achievable and sustainable, you also have to feel great on the inside. And we believe our mindful approach to aesthetics allows us to achieve both looking good on the outside or looking our best, as well as feeling our best on the inside. What separates MSPA from many of our competitors, perhaps all of our competitors, in addition to the medical and mindful approach that we take to each and every patient at each and every interaction, is our focus on being modern. And we're not just talking about the fact that we built MSPA from the ground up. We're talking about using technology in a way that allows you to communicate with your service provider at every moment of every day, whether it's in person, over the phone, through email, or social media, or however you feel most comfortable. But in addition to being able to use technology to our advantage to communicate with our patients, we also want to make sure that we have the latest, safest technology for all of our products and all of our services at MSPA. So after a full year of meeting and planning and creating the vision for MSPA, and really there's two visions that you have to create here. One is the clinical vision, what you want the spa to look like, how you want it staffed, what type of equipment you want to have, the policies and procedures and process that you want to have in place. You have to have a vision for that and somebody that shares that vision. And then there's the vision for the business of the spa itself. And that was something that, took a little bit of time to create, but what we've come up with for MSPA, both Dr. Hancock and I, is we see that there could be 5 locations in 5 years generating $5 million in net operating income. We call that the 5-5-5 plan. 5 locations, 5 years, generating $5 million in income. Now, we're starting with the first location, which is Boca Raton. And after Boca Raton is built and up and running and profitable, either through organic growth or through acquisition, we believe that we'll have 5 locations for MSPA in 5 years. So strategically partnering with non-competing business professionals, that's something that can be seen throughout many different industries. You know, with my background, the way that I saw that take place, both inside the organization and outside, looks something like this. If you were to take a close look at many financial professionals, financial advisors, you'll find that they have very deep relationships with non-competing business professionals, like, for example, trust and estates attorneys or accountants. You find that there's a history of these folks working together to not only serve clients that they have in common, but also to find new clients. And so the concept of working together with non-competing business professionals, it's not a new one, but it is difficult to master that. My background working for some of the largest investment firms in Wall Street really allowed me an inside look at how boardroom conversations take place. It allowed me to see how competing professionals, whether it was somebody at our firm or somebody outside of our firm competing for the same business, for the same opportunity, it allowed us to see how we could work together when possible, or even find a way to work together when we were in competition with each other. So, you know, from my perspective, I always felt like there was an opportunity to leverage the resources around me. And when it comes to MSPA, I know how to run a business. I understand how the business should look. But I needed a partner of equal caliber for the medical, for the clinical side. And that's what mattered most to me. If we were going to build something from the ground up, it had to have the higher standards. It had to have the highest level of care for each and every patient. And so I was looking for a partner, someone to help me build this company together, someone that had those types of standards. And that's what led me to Dr. Melissa Hancock. So one of my favorite examples of strategic partnering with a non-competing business professional came when we were looking for someone to create a private label skincare line for us. And we came across just a fantastic 100,000 square foot FDA approved laboratory. And as soon as we started our process of reviewing the products and getting to know the people, we learned pretty quickly that this was not just a company that created skincare products, but they also offered assistance with branding, with marketing. They helped us uncover trends that were taking place. They helped us avoid some landmines. There were some global supply chain issues with certain raw materials that they were able to make us aware of. So in the end, we were able to create a beautiful custom private label skincare line, and we were able to do it with folks that knew what we wanted because they took the time to ask. When you're thinking about the partnerships that are going to be the most relevant for you today, clearly there needs to be a focus on your social media content. You need partnerships that not only help you create the content, but get that, you know, those videos and those posts and everything else that you're doing to market your products and services seen on your social media accounts and throughout the internet. If you're not being seen, I can assure you that you know, your competition and those that are starting franchises or new medical spas today, they are. And you have a lot more people that are coming from outside of the medical services industry, like myself and like others, from private equity and elsewhere. They know how to do this. They've been doing it for years in their own businesses, in their own industries, with their own companies. There's never been a time more important than right now to have those strategic partnerships with the folks that can help you increase your social media campaign and your social media relevancy. So in closing, let me start where I began. I want to say a very special thank you. Thank you for the opportunity to share just a couple of quick thoughts about strategically partnering with non-competing business professionals. It's the entire foundation upon which we've built MSPA. It started with myself and Dr. Melissa Hancock. We both of a growth mindset. We both had a vision of creating what we believe is going to be the single greatest medical spa in all of South Florida and perhaps around the country, and then finding like-minded individuals both on the clinical side and outside of the medical industry to share our vision and help us build MSPA together. So thank you again for watching today, and I'd like to invite any of you to reach out to continue this conversation. Please feel free to contact me. Thank you so much for your time. Have an amazing day.
Hi, thank you for joining me today for my presentation on improving patient care and driving revenue with cognitive screenings. I'll be your host for the presentation. I'm Lori Adams. I'm a doctor of audiology and a CogniView employee. I am the senior manager of customer training and utilization for CogniView. Prior to joining CogniView, I previously saw patients in the Washington, D.C. area, as well as New York, Rochester, New York, that is. After completing my AUD at the University of Buffalo, I also have my bachelor's in communication sciences and disorders from Nazareth College in Rochester, New York. I've always believed in the ear-to-brain connection and educating my patients as well as the community about the need for routine audiological care and early intervention. I have previously served on the board of directors at the Academy of Doctors of Audiology, as well as chaired and served on many of their committees. My disclosures are I am a full-time employee of CogniView, and I have no other disclosures or conflicts of interest for today. So cognition and cognitive decline, it is a relevant topic and emotional topic for our patients in our community. This study that was released by the American Alzheimer's Association looked at the diseases that people were most worried about at all ages. And as you can see by this graph, Alzheimer's disease was the #1 across the board, whether you were a boomer or a millennial. And it equaled all of the others combined between arthritis, diabetes, heart disease, stroke, or cancer. Alzheimer's was top of mind. And so that really leads us to why cognitive screening and trying to get the community awareness is really important. So what brings cognitive screening into audiology? And I don't know if you're familiar or not with the Lancet Commission article that looked at 12 modifiable risk factors that can contribute to cognitive impairment. What they found was that hearing impairment was the #1 modifiable risk factor for cognitive decline when addressed in midlife. And many studies are being done to show that treating hearing loss midlife could possibly delay or reverse cognitive decline. So Lynn and Albert had released an article talking about common etiologies that can be related to cognitive performance, and those are aging, vascular disease, and socioeconomic factors. But when we look at the connection to hearing impairment and cognitive decline, specifically, there are 3 theories that can explain the correlation, and they are cognitive load, changes in brain structure and function, and reduced social engagement, which can lead to depression and ultimately dementia. Another study released recently quoted, "The increased cognitive effort or load exhausts neural resources normally devoted to other tasks, which in turn contributes to the clinical symptoms of dementia. Specifically, we see lower scores in memory and executive function, and hearing loss and dementia have very similar symptoms. And so our hearing impaired patients report difficulty understanding. They can hear, but they don't understand. Similarly, our dementia patients, they can usually hear the sound, but they just don't understand the meaning of the words. So both of them can present with I can hear, but I can't understand symptoms. So it's important to understand the difference in our patients. And that's where cognitive screening can come in. And the impact of cognitive performance is a two-way street, as they are directly correlated with each other. So not only is good hearing necessary for good cognition, but good cognition is needed for good hearing, particularly in complex listening environments like a noisy restaurant or church. There have been a lot of pen and paper tests over the decades that have been used, most commonly the MOCA, the SLUMS, and the MMSE, but there are issues with those current cognitive screening tools. 1, you have to train your staff to administer and score the test. 2, there's possible human error in scoring process, and it may lead to inaccurate results. 3, the lack of consistency when used across multiple sites or practice locations. 4, the low test retest reliability. And last, the multiple associated biases. that come with many of those tests. So this is what led to CogniView. In 2005, neurologist Patrick Duffy began to develop the technology with a grant that he got from the NIH. And over 15 years, researched and developed the technology. In 2015, he received his Class 2 de novo medical device clearance with the FDA. In 2020, Tom Golisano, who's the founder and chairman of Paychex, acquired CogniView and began to work on commercializing the technology. Our original devices were pretty bulky. They looked like an old microfiche machine, and Mr. Golisano wanted to make sure that cognitive screening would be more accessible for patients. So what is now developed into these more laptop-based models allow for easier access. There are also many key benefits of computerized adaptive self-administered screening options. And that is it removes biases associated with traditional testing. Those common biases could include race, education level, and other social economic factors. Removes environmental variability. So the way the technology is designed, it will protect from distractions and light interference and provides the same testing environment between all testing locations. And there's no ability to learn tasks, so proven test-retest reliability. It accounts for varying physical abilities. So there's dynamic changes and adapts the test to visual and motor ability of the user. It does not rely on auditory stimuli, which is particularly important for our hearing impaired patients, and no training to administer. So anyone on your staff may initiate testing. Results are generated automatically and available immediately. So our Cognitive Thrive is an alternative to those screening methods. So a basic overview, it's a 5-minute self-administered computerized test. It's going to evaluate 3 cognitive domains, which are memory, visual, spatial, and executive functioning, and measures 2 speed performance parameters, reaction time and processing speed. So you can see here a basic breakdown of the different screens that your patients will see. Motor skills and visual acuity are just calibration tests. They are not factored into the scoring at all. So motor skills will check for your patient's dexterity, while visual acuity will check for visual saliency to see how the test may need to adapt and be brighter for your patient. Word perception is just going to be noticing a real word compared to nonsense words. Shape is going to be the shape that, say, perception is the shape that looks different than the others. Word memory will be remembering the first word that pops up in the center as it goes along, and shape memory is the same thing, remembering the first shape that pops up in the center. And here we have a little short video to show you how Thrive works from the patient's perspective.
It's not an IQ test or a series of questions and answers. It's a series of different exercises. Before each exercise, you will be provided with 2 practice sessions before you take the measured exercise. Motor skills. In this exercise, we will be capturing your current motor abilities, which differ from person to person. The exercise requires you, to the best of your ability, attempt to keep the green wedge on the moving white dots. Visual acuity. This exercise uses the same green wedge, but this time you're being measured on your ability to track the moving white dots as they become more faint. Word perception. This exercise uses common 3-letter words within the English language. You are challenged to find the real word among non-word symbols. In this shape perception exercise, you are asked to find the shape that is different than the other shapes. These are not normal shapes you would expect. Rather, they're visual cues to help us measure your ability to perceive which shape is different than the other. Word memory. In this exercise, we use the 30 most common 3-letter words in the English language. A word will be placed in the center, followed by other words. You will be asked to remember and select the first word shown. This exercise will be extra challenging if you don't follow the instructions. The instructions will ask you to remember and identify the word that appears in the middle first. Select the correct word as quickly as possible. Shape memory. In this exercise, you are challenged to remember shapes that are unique. These are not normal shapes that you would expect. A shape will be placed in the center, followed by other shapes. You will be asked to remember, identify, and select the first shape shown. Let's review again some important recommendations. Eliminate distractions like your cell phone. Keep friends and family at a distance as you do the exercises. Stay focused on each exercise. If you wear vision correction, please use them before the exercise begins. Use your dominant hand, which is usually the hand you write with. It is very important you read all instructions carefully. Stay calm under pressure. Each exercise will get progressively more difficult. Select the right answer as quickly as possible. If you remember to follow these suggestions, it will help us get the best measurement of your current cognitive performance. Once the screening is complete, you will receive a personalized one-page report from a cognitive performance representative.
So as it said, it gives you a Thrive report, which is fantastic. It breaks down the performance of the individual cognitive domains. It's a user-friendly format to facilitate effective patient counseling. It's available immediately following the assessment. And it's not necessary to go into detail. I know it breaks it down, but it's not necessary to go into that detail when discussing the results with patients. It's all about providing a holistic view of their performance and how it relates to their treatment. You'll see that we do have two different colored copy reports here. The one on the left is what we consider our provider report, has a little bit more information on it. Originally, our original reports were these colors from red to green, so we wanted to make sure to keep that. And then we have this one here that's more grayscale version, a little less information. We consider this our patient report to send with the patient. But as you can see, the memory, visual, spatial, and executive function, their different parameters are right here along the bottom, as well as the speed performance areas, which can be very important with how that patient is performing with their hearing aid, especially performance speed. We also have a CogniWell program. So this is another sheet that you can give your patients, and it's evidence-based recommendations on how the patient can manage some lifestyle-related risk factors or certain medical conditions in order to delay or prevent cognitive decline. Things like medication management, reviewing their medication list with their primary care physician or their pharmacist, exercising regularly. Exercising their mind can improve their brain performance. This one is fantastic for helping our patients understand why we might be asking them to do an oral rehab program like LACE or CLEAR or Amplify, or a non-auditory one like Brain HQ or Luminosity. And it will help with patient compliance with that because they understand the connection better. Maintaining social connections, sleeping, and doing well there. Some people have CPAP machines and they don't wear them when they need to, and that could impact their cognitive performance. Eating healthy, hearing healthy, so definitely if they have a hearing loss, treating it, and optimal vision as well. So we really are stressing to a lot of our practices that are bringing CogniView on board is to really help differentiate your practice, to have a more patient-centered care plan by looking at a functional and communication needs assessment. This graphic here comes from Alicia Spore's article in the Hearing Journal in January 2021. And these were different areas that we can incorporate, making sure we have a great medical case history, but getting quality of life questionnaires, depression, dizziness, hearing, getting some cognitive history on the patient, vestibular screenings, vision dexterity screenings, and making sure with our audiological testing that we're also getting some unaided real ear, speech and noise testing, which could lead to some auditory processing testing needed. We are noticing a significant amount of patients that come in with normal hearing, and they may have some moderate to poor results on their CogniView, which would lead to a need for some further processing, auditory processing testing, and then as well cognitive screening. So implementing cognitive screening for various types of patients. We want to always remember that the cognitive screening is not a standalone test. It's just part of a protocol. So that's really why we are suggesting that communication and functional needs assessment protocol. With new patients, it offers a comprehensive evaluation, looks beyond the peripheral auditory system to better understand how they're going to be processing across the ear to brain pathway. Functional and communication needs assessment, functional hearing assessment, as they may be called, which can help guide device selection, accessories, and rehab treatments. On our existing patient, it really allows us to measure improvement after they're wearing their hearing aids if they took the CogniView pre-hearing aid, as well as ensure that it's not an issue with issues not previously identified may be affecting their expectations or need for accessories. You know, that long-term patient who may be that frequent flyer and is taking up a lot of space on the schedule often for adjustments, and they should be performing better than we think based on their audiological testing, their real ear measures. This is a patient that it would be great to have some CogniView results on, because there could be underlying cognitive issues that are not allowing them to be successful with their hearing aids, and can help the patient understand, but also for you to understand better where you may need to make some adjustments in programming to help them. And then for cochlear implant candidacy evaluations as well. So it really allows for outcomes to measure pre and post implementation for that patient to have some realistic expectations. The benefits of incorporating CogniView for your practice. I like to think there are a lot. It increases patient satisfaction. It allows for a more patient-centered care approach, the ability to increase patient traffic and retention. It allows for a more integrated role in the overall healthcare ecosystem. It helps differentiate our practices. It expands practice revenue generating opportunities. It allows for more targeted rehabilitative measures that may contribute to more successful outcomes for our patients, and can help manage clinic time spent with patients. As I was mentioning with that frequent flyer, that may allow you to understand more in depth what's going on with that patient, so that we can move forward and hopefully get them to understand what's going on, and also to give them some different options that may benefit them more. And then our patient benefits of incorporating cognitive screening. It helps guide their device and accessory selection. It may allow for earlier adoption or greater success of their hearing aids or cochlear implants. You know, patients understand a little bit more about the ear to brain connection and understand the need for the hearing aids. And that also leads to compliance, because again, they do. I mean, time and time again, I can't tell you how many patients have come in and they've said, yeah, I've worn the hearing aids. And I'm always like, data logging shows that's not the truth, right? That they haven't been wearing them like they need to. This allows for a little bit more compliance because they understand what's going on. So again, understanding how cognitive impairment or performance could impact their audiological abilities. It allows for proactive managing cognitive and hearing health. It impacts the patient's ability to process speech, especially in the presence of noise, so understanding how those scores. And again, realistic expectations for CI patients post-implementation, and increases compliance of use with oral rehab and brain training programs as well. CogniView has numerous resources to help educate the patients and help promote cognitive screening, whether it be our flyers, our rack cards, our posters, as well as some different topics have been, some of you may be familiar with the Balancing Act that's on the Lifetime Effort Network. We had a couple series that were done by Al Turey, Jill Davis, and Noelle Crosby as well. And we do also help with website content as well as social media for your practices. So really, I want to thank you for taking this time out to really understand how CogniView could help differentiate your practices and help your patients and your practices thrive. Feel free to reach out to me with any questions that you may have afterwards, or I'll also be here as well as this gets presented. So if there's any questions, feel free to ask them and I'll answer. Have a great night. Thanks.
Welcome, everyone. We're so excited to have you here, and thank you for joining us virtually. Please take a moment to familiarize yourself with the platform and join us for a live Q&A session afterwards. Welcome to our session Balance your day by elevating your patient's engagement. My name is Sandra Azor, and I'll be hosting today's session alongside Jessica Santinello. In a moment, Jessica will introduce herself, but as for me, I've been with Modernizing Medicine for over 4 years, training and implementing our practices on our practice management solution. I also have over 10 years of experience in the revenue cycle management industry, working in central billing offices for hospitals and practices. Now over to Jessica for a brief introduction.
Hello, everyone. My name is Jessica Santinello, and I am a clinical solutions engineer. For the past 3.5 years, I've traveled all across America working with practices very similar to your own to help teach and lead implementation into their practice. I also have a master's in healthcare administration, and I am so excited to do this webinar with you today.
Thank you so much, Jess. As a disclaimer, this presentation is intended for informational purposes only. Please take a moment to read over this. Modernizing Medicine was founded in 2010 by our co-founders, Dan Kane and Dr. Michael Sherling. Dr. Sherling mentioned to Dan that he was spending a large amount of time after clinic documenting. So Dan made it his mission to code a solution that was not only intuitive, but also user-friendly. Since then, we've opened up several offices with our headquarters located in Boca Raton, Florida. As of September 10th, 2021, we have secured a total of $322 million in investment funding and have scaled to over 1,300 employees. Let's take a glance at ENT specifically. We're growing exponentially with over 1,000 providers and almost 200 practices. We're also a company that continues to invest in the future of the industry. So as you can see from those development dollars, our product is personally coded by Dr. Lehman, a practicing otolaryngologist with ENT AAF. It thinks like a physician and it is super intuitive, and that's why we have been ranked #1 by Blackboard for 7 years in a row. What gets us most excited though is the feedback from you as our clients. You can see the reviews here that reference how Modernizing Medicine, how Emma has truly changed the way these physicians practice medicine, unburdening from daily woes and documentation and giving them their lives back. We look forward to working with you. Not only do you have the experience that benefits our platform offers, but to also give us feedback and help us to further enhance the ENT platform.
Right now, we completely understand that during this unprecedented and challenging time, you're being inundated with information from people inside and outside of your practice. Regulations are constantly changing, new guidelines every single day, payments are uncertain, it's very overwhelming. Our goal is to filter out the noise by giving you a practical approach on how to stay in touch with your patients. Modernizing Medicine allows practices to stay connected with their patients through a variety of different engagement tools between self-scheduling, reminders, and telehealth. You can offer multiple opportunities to connect with your patients. Today, we will be focusing on Pocket Patient, which is our smartphone application for patients. This allows them to access their medical information at any point in time, which will keep patients connected with your practice. Key features of Pocket Patient are allowing the patients to view past and upcoming appointments, refill prescription requests, message the practice, perform telemedicine appointments, and complete their patient intake information. This will allow patients to stay involved in their medical care, pay their medical bills, and view any test results. We will now go ahead into a demonstration of Pocket Patient mobile check-in. 24 hours before the patient's appointment, they will receive a convenient automated text message. The patients can select the link and they will be directed to Pocket Patient. The patients can then enter a few simple pieces of information like their last name and date of birth to get logged in. Once they log in, they can begin their check-in process, and they can easily review and make any updates to their demographic information. If any changes are made, this will easily allow your front office staff to be alerted when changes have been completed. This is going to keep the process simple and transparent. They can also review any insurance information, which will again prompt your front office staff. If you have any documents that you want your patients to sign prior to their appointment, they will be able to do so through Pocket Patient. They can review the document, and when ready, they will be prompted to sign. This document will directly push into the patient's chart, reducing any type of data entry. If a patient wants to add a pharmacy, they can simply do that through the application. This will allow you to conveniently e-prescribe any types of medications to the patient's pharmacy. Patients will also be able to review their medical information. They will have a very high level of visibility of this. At any point in time, they can log into Pocket Patient and complete their medical information. This will allow your staff to now focus on patient care versus data entry. Having the patients to be able to conveniently enter their medical information will reduce any type of bottlenecking when they check into their appointment, along with reducing the workload on your medical staff. Please keep in mind that patients can complete all of their past family social history, medications, along with allergies. It is super user-friendly and very intuitive, allowing the patients to easily document any type of information they might need. Once the patient is done reviewing all of their information, they will simply tap done at the bottom of the screen, completing that check-in process. If patients do have any type of co-pays or balances on their account, they can also complete this through that Pocket Patient app. They can simply select on whatever amount they want to pay to. If they want to change the amount being paid, they could do all of this with just a few taps, again, at their convenience at any point in time. If they have a saved credit card on their account, they can simply select whichever one they want to pay it from. Now, looking at the view for your medical staff, they will simply be able to go into the patient's chart. The changes that the patient made from Pocket Patient will conveniently pop up automatically once they're in that chart. Your medical staff can easily accept or reject the changes that the patient has made through Pocket Patient. This will directly push into the patient's chart, making it quick and efficient, allowing them to be able to complete any other workflows.
Now that your patient is here, you have complete visibility to make any changes or updates that were made during the mobile check-in process. As you begin to check the patient in, with the alerts that are presented throughout the different areas of the platform, your staff can quickly reconcile those updates. As we begin to check in, you can quickly accept or reject those. The process will also be simple because your back office team can go in and make those changes and see those pertinent information to reconcile quickly and easily. Our intuitive software is also going to highlight those updates in each section of the chart. So if there were any insurance updates, your staff can quickly see that information. And as they continue to manage and make those changes, they can also quickly dismiss if the patient did make any mistakes as well. In addition, any payments that were made will come through and have that visibility under your appointment transaction section. This concludes our session on how balancing your day by elevating your patient engagement can hopefully help you all see how you can quickly and easily get those updates from your patients, where it's going to streamline back into our solution and make it really easy for your staff to reconcile those updates. Again, thank you so much for attending our session, and we look forward to you joining us in our live Q&A directly afterwards.
Thank you for joining this session. Today, I'll be speaking about using point-of-care CT to increase procedure revenue within the ENT practice. In order to discuss increasing procedure revenue using point-of-care CT, we'll do a quick market recap. We'll look at your practice's workflow. We'll look at specific examples of ENT practices and their CT use in Florida, as well as next steps in order to capture point-of-care CT in your office. Before we begin, just a little bit about myself. I'm the National Sales Director for ENT for Zoran Technologies. I first started selling CT into the ENT office in 2007, and since then I've been able to help physicians across the country implement CT into their ENT office. I'm familiar with just about every state, including state regulations, insurance providers, as well as reimbursement. Before we begin, I have no disclosures or conflicts of interest with the presented material in this presentation. An overview of what we plan to discuss, as I mentioned, a quick market review, benefits to your workflow, how CT can assist with procedures and procedure revenue, market trends for CT use, compliance, and patient retention. The Academy estimates that there are 12,000 ENTs based in the United States. For every 40,000 people, there's one ENT estimated to be able to help them. The number of ENT physicians is growing slower than in other specialties. 45 to 64-year-old patients are most likely to visit an ENT office. The market anticipates the demand for hearing and sinus treatment to continue to increase with an aging population. Increase in patient satisfaction is the #1 reason reported for purchasing point-of-care CT. Let's take a look at your patient workflow. Before we talk about patient workflow, I'd like everybody to take a second to think about how workflow currently works in your practice. And as we dive into the workflow of point-of-care CT, continue to think about how that can help improve your time with your patients. We have found that implementing MiniCat into your practice can save your patients 1 to 2 visits.
Today, more than ever, patients want convenience, safety, and simplicity. With the MiniCat, you're able to deliver high-quality CT scans of the sinuses and ears at your point of care. Your patient sits comfortably in an upright chair, while an overhead arm makes a single rotation around the head. MiniCat scans have significantly less radiation than the traditional full-body scanners, and a typical scan only takes 20 seconds. Find out how the MiniCat can be a patient compliance game changer for your practice today.
If you don't have point-of-care CT, your workflow probably includes seeing a patient, needing to send them out for a CT, and then having them either come back into the office or schedule a telemedicine visit to review those results. By implementing point-of-care CT into your office, you'll now be able to see the patient, diagnose the patient, and come up with a treatment plan right away. We help the practice reduce the time from when they first saw a patient to when they were able to bill for a procedure from 55 days down to less than 27 days. CT will help improve your practice's workflow by reducing your backlog. Many ENT offices report several weeks before they're able to see new patients. Now, fill those time slots with new first patients rather than returning patients who you have to review imaging with. Physicians report being able to get back to what they were meant to do with more time for surgical procedures. CT practices also report an increase in practice revenue, procedure reimbursement. Administrators report shorter payment cycles and increased billing speeds. Peer-reviewed white papers show practices lose, on average, 2 out of every 5 patients sent out for CT. Peer-reviewed white papers also show a 50% increase in compliance when you can demonstrate imaging to your patient at the time of their visit. Now let's take a deeper dive into how Florida compares against the rest of the country. In this chart, these numbers represent all of the Florida mini-cats for years 2016 through August of 2021. Here you can see a comparison of the total number of scans done, total number of mini-cats in a particular year, as well as the average number of scans per mini-cat. As to be expected, there is a dip between 2019 and 2020 due to the ongoing global pandemic. However, volume through August of 2021 show a healthy rebound with one of the busiest times still ahead. Keeping on track with global CT use, the number of scans done on mini-cats throughout Florida continued to increase every year from 2016 through now. If you've implemented CT into your practice, have you reviewed to see if it's been optimized? If you have not implemented CT, do you know roughly how many scans you do per month? What you see here is the average number of scans for a practice size over the last 4 years. Single physician offices have averaged 32 scans per month over the last 4 years. In a 5-doctor practice, CT use increased almost 20 scans per month from 2019 to 2020. While there's the expected increase in number of scans averaged per month between a practice size of 1 and 2, we found that practice size with 3 physicians actually decreased the number of scans. We attribute this decrease to having multiple offices. Monthly scan volume continues to increase with 4 and 5 physician practices as well. More practices over the last 4 years have implemented a second or third mini-cat in satellite offices. As surgical cases, both in the office and in the hospital, continue to increase, CT continues to be utilized by practices at their main office as well as their other locations. As practices look for new ways to retain patients, let's look at how you can implement CT into your office. First, you'll need to identify a location for your CT. What are the size requirements? We always recommend trying to use a space that currently is not revenue generating, perhaps an old file room, perhaps an old room with charts, a storage area, or an administrative office that's not being used. Next, calculate your scan volume on average over the last few months. CT can be placed in as small as a 6x9 room. However, if you need smaller, accommodations can be made for as small as a 5x7 area. You'll also want to work with your staff on your scanning procedure. And finally, you'll need to work out a time for reporting on the CTs. Next, you'll need to understand how CT will directly impact your patients and your practice. Who pre-certs now for your CTs? Who reaches out to insurance providers to check deductibles? Have you identified slowdowns in your workflow and how CT can help speed those up? You'll need to identify a space and a time for patient review of those scans. Your peers continue to work with CT companies on marketing, helping to identify scheduling, helping to reach out to first-time patients, and of course, generating additional revenue with CT reimbursement. Florida ENT practices have continued to prove that CT works in your practice. Florida ENTs have increased CT optimization. When's the last time you evaluated efficiencies and opportunities across all of your locations? ENT offices in Florida report increased practice revenue from CT. They report increase in procedure revenue from CT. And as we discussed, increases in payment and billing speeds. The first Florida MiniCat was installed in 2005. The average age of a Florida MiniCat, 5.5 years. In the state of Florida, there is no certificate of need law that would stop you from being able to implement CT in your office. Unlike other states, there is no CON law in Florida that would stop you from implementing CT. State regulations also require a physician or a tech be the one to operate MiniCat. While Medicare and United Healthcare are the only two providers who require accreditation on a nationwide level, we strongly recommend to all of our customers to get IAC accredited once they implement MiniCat into their practice. We are proud to have helped thousands of physicians get IAC accredited. A large part of staying compliant is having a partner who will support you with IAC accreditation, state regulations. Thank you for joining me today, and now we'll open up the floor to any questions.